Ladies, if you can't jump on a trampoline, or if you have to cross your legs, if you cough or sneeze or are laughing too much, you possibly have a degree of urinary incontinence. So apparently urinary incontinence is quite common after having a baby, and it is something that many women get embarrassed about, and they delay treatment. So tell me, Dr. Liz, it is quite treatable, but first tell me, how common is it?
Well, some studies suggest that over the course of a woman's life, maybe about half of women can experience urinary incontinence, but that doesn't mean that it's a permanent condition for everybody. So for some people it might be just if they have a urinary tract infection, or they let their bladder fill up too much, or it can be related. For some women it's just when they're pregnant or soon after, but there are women, and it's not uncommon to perhaps have a degree of incontinence every day. And there's different types of incontinence. Different
degrees. And it's not just old women, it's women of all ages.
Yeah.
Even younger women as well.
Yeah.
That haven't had children.
It can occur, without having had kids. So,
So when should women see something about it? Because women are really good at getting things sorted, but for some reason, it's a little bit of an embarrassing one if you have a little bit of wee coming out when you laugh. So when should you come and see someone about it?
Yeah, so well, you can try a few things before you see somebody. So, for example, you can try pelvic floor exercises. Now, you can try and Google it and teach yourself, but they reckon maybe about 30% of women don't activate their pelvic floor muscles adequately enough. So there's a special type of a physiotherapist, and it's called a pelvic floor physiotherapist, and they can teach you how to activate or check that you are activating that muscle group properly. In addition to pelvic floor physio, you might also modify some stimulants for your bladder, which can include dehydration or drinking too much water, or alcohol can make some people incontinent. Too much caffeine can make people incontinent. Sometimes as well, people may be incontinent because of certain lifestyle factors, including smoking, being overweight. All these things are modifiable. Once you maybe have a go at trying to correct some of those, if you are experiencing urinary incontinence daily, you should consider maybe touching base with your GP, who will often evaluate you as a first-line management. If the incontinence is still persisting and is affecting your quality of life especially, your GP may consider referring you on to either a gynaecologist or a urogynaecologist or a urologist. There's a lot of ologists.
And a friend of mine, talking about the exercises, her mum always said to her, when we're at the traffic lights, lift up your buttons, girls. And they'd have to do their pelvic floor exercises.
Yeah, if you're doing pelvic floor exercises, you really need to commit. If you do really good training with your pelvic floor, you can resolve over half of incontinence. So using a trigger as simple as a traffic light to train you to do that multiple times a day is a great way to try and restore your pelvic floor function and continence.
There we go. Yeah. So how is it treated then? Because obviously, if it's been diagnosed, then what's the treatment?
Yeah, so if you...
Besides nappies.
So if you are persisting with urinary incontinence, despite those lifestyle measures, it depends on the type of incontinence. So you need to get assessed by a doctor usually. The assessments look to see if you have a type of incontinence due to urgency. So maybe your bladder's overactive, in which case overactive bladder can be managed with bladder retraining, or it can be sometimes managed failing that with medications. If you have incontinence when you're coughing, sneezing, linking, jumping on all the trampolines.
We do that all the time.
I know. Like everyone's just got all these adult women jumping on the trampolines.
Yeah, I can't wait to get home and jump on the trampoline.
So there you might look to consider, there are some surgical options available, and there's quite a number of different surgical techniques, but that will depend on the doctor that you see and what their mode of treatment is. But yeah, those are the common starting points. Some people have nerve problems as well, and they might see a neurologist for that. There's a huge range of techniques that can be used to manage incontinence.
Well, there you have it. So as you can see, there are plenty of treatment options for urinary incontinence, and there's nothing to be ashamed of if you're having, some wee problems. Wee problems, get it? Little problems?
Yeah.
Got it, yeah.
It's hilarious.
If you are considering treatment but still get a bit nervous to bring it up with a medical professional, take this as a sign. Give Dr. Liz a ring today and get back to bouncing on that trampoline with the kids. Are we going to do it this afternoon? You going to do it with yours? Yeah. Bounce. Let's do it.